And first of all, I also want to join with other deputies in extending my deepest sympathies to the families and friends of lost loved ones during this shocking crisis. And yesterday, obviously, we went through a shocking milestone in the country, in that now over 1,000 people have died on the island of Ireland from COVID-19. I also want to thank all the men and women who are on the front line currently. These men and women are working beyond the call of duty. They're putting their own health and lives at risk for the most vulnerable. And I think that we owe them an enormous debt of gratitude that we shouldn't forget when this crisis is over. I want to acknowledge all the work that the government has done too over the last 2 months. And the development of this crisis and the management of this crisis has been very, very difficult due to the enormity of the crisis and due to the fact that we simply don't still know all of the different behavioural patterns of this particular virus. However, the role of the opposition is also to propose solutions, to scrutinise the government and to push the government at all times to make sure that we have better outcomes for the Irish people. And the mortality rate in Ireland at the moment is shocking. It is the 12th worst figure in the planet currently. We also have one of the worst mortality rates in the nursing home setting in the world as well. And this is, I think, doubly shocking given the fact that we are an island nation, given the fact that we saw this crisis unfold in other countries and had time to prepare. We had a head start, if you like, to prepare for that. And given the fact that we have a young population and a dispersed population, it would lead me to believe that we were in a better position to be able to deal with this particular crisis. I believe that it was wrong to stop the flights, not to stop the flights coming from the north of Italy at the start of this crisis. It was wrong not to tell people who were returning from the north of Italy at the time to continue as normal if they did not have symptoms. And it was wrong not to risk assess these people at airports. And you might say that, this is okay, this is hindsight, and this is history. But that's not exactly the case at the moment. For right now, we still have a situation where seasonal workers are landing in Ireland to pick fruit this summer. And last week I raised the issue, and the Chief Medical Officer said that day that it was not good public health policy to do this in the middle of the pandemic. And the statements from the Taoiseach's office that day varied from, in the morning, these are essential workers and they should come, to in the evening, that you shared the concerns of the CMO and that you were seeking an urgent review into the practice. Now, it's since transpired that the government actually lobbied the EU to allow the movement of these seasonal workers right across the EU. Taoiseach, do you agree with the CMO? Do you think that we should actually adhere to the policy of restricting people's movement? And will you make a change to that policy in the future? And also, we are still only providing leaflets at airports currently at the moment. Taoiseach, is it not time to ensure that we have medical professionals in airports who are properly risk assessing people who are entering the country? I want to raise the issue of the nursing homes. The nursing homes are in absolute crisis. Dr. Marcus de Bruin, who was appointed to the Irish Medical Council by the Minister for Health, stated these are the biggest political blunders in the history of the state. He said the nursing homes featured as something as an afterthought, and the timeline of inaction with regards to nursing homes beggars belief. At the start of March, many of the nursing homes instituted restrictions to visitors coming into their homes. But on the 10th of March, the government said socially restrictive actions around hospitals or nursing homes are not necessary at this moment in time. The next day, it was opened up in many nursing homes around the country, and visits remained open for the next 3 weeks. Until then, it was banned by the government. On the 17th of March, the HSC directed that nursing homes promote good hand washing and also put up information posters in their nursing homes. Now, given that the death rate internationally on that day was 7,500 people, in March, many nursing homes sought blanket testing for residents. On the 4th of April, the government promised those blanket testing for staff and residents, and yet now it's only kicking in. So half the nursing homes around the country still have not been tested in this way. And it also, that these tests that are finally happening are revealing a shocking picture. There are now 1,944 confirmed cases of the virus in nursing homes throughout the country. This is 61% higher than the government figure on Monday. Now, the scale of this the differential in this, to me, shows how important that testing was, both with regards to treatment of residents and workers, but also in understanding the depth of the crisis in nursing homes. On the 19th of March, Nursing Homes Ireland wrote to the Minister for Health seeking an urgent meeting or conference call. However, 2 weeks later, the Minister for Health, who responded to a press statement that Nursing Home Ireland put out that they still had not met with the Minister for Health, said at that stage that he would look forward to meeting with their representatives soon. Now, on the same day, on the 4th of April, we were promised that there would be a financial support scheme given to nursing homes. Incredibly, yesterday, we found out that not 1 cent of that financial scheme has been spent in any nursing home in the country as of yet. And staff at nursing homes and the representatives have been excluded from the National Public Health Emergency Team. Now, obviously, we are in the jaws of a crisis and we need to focus all of our attention on fixing that crisis. But when this crisis subsides, for future health policy, I'm asking the Taoiseach, will he commit to an investigation of how the nursing home sector was handled in this country? Also, there will be no lifting of the lockdown until we're testing the outer ripple of this particular virus as it goes through the population. And testing is key to lifting that lockdown. It's key to saving lives, and it's key to easing the financial burden that is now coming onto this country. But testing too remains in crisis. On the 19th of March, the Minister for Health said that we would reach 15,000 tests in a matter of just a few days. 1 month later, we're testing at a rate of a third of that particular objective. Now, people have been waiting for weeks for the results of their tests, and many medics will say that delayed tests means delayed treatment, which means delayed outcomes for patients. And I too have worked with a family who lost a loved one who deceased, and the test was 2 weeks before it came back to that family. So that family was unable to bury their loved one for 2 weeks, and we had to chase up that particular test for that family so they could relieve the stress that they were in as well. And the criteria for testing in that element of the crisis was then narrowed. It wasn't narrowed for clinical reasons, it was narrowed for capacity reasons. And the criteria still hasn't been broadened out. So many people with symptoms of COVID-19 today won't get a test for COVID-19, even if they have the symptoms. The testing of asymptomatic people who have been in contact with confirmed cases, which is the holy grail of actually solving this crisis, is still not even on the horizon when it comes to this state. Now, I understand, obviously, for a long period of time that testing reagents were simply not available in the quantities they needed. But yesterday, startling, we found out that the state has the capacity now to test 10,000 people a day. How many people is the state testing a day? It's testing 5,000 people. We have the capacity to do double the number of tests that we're currently doing. That's an incredible figure, given we know how important testing is, that the WHO are saying test, test, test. So capacity is no longer a brake on testing. Government policy is now a brake on testing at the moment, and I think that's startling news. And I would ask the Taoiseach today to commit to testing at a rate of capacity immediately. Finally, Taoiseach, hospital avoidance is a radical problem in this time as well. And I believe it's a significant threat to both health and life of people. And I've heard of one particular hospital that sent out 60 invites to individuals for elective colonoscopies. 4 people turned up to those 60 invites. I've also heard of a number of people, including cancer patients, who have had their particular engagements cancelled. Will the Taoiseach today do 2 things? Will he commit that cancer patients don't have any of their treatments cancelled in this state, and also that there's a public information campaign telling people who are in need of elective procedures not to avoid hospitals? I believe that some of the excess, and it's estimated that a good chunk of the excess of deaths that are occurring at the moment that are not COVID-19 related are actually related to the fact that we have significant hospital avoidance in our health service.
Thank you very much.